You should be ready. 3, 2, 1. You are live right now.
Good morning, Public Health family. I am Teresa, Cohen, Health Director in Wilson County and your current NCPHA President. It is my pleasure to welcome you to the North Carolina Public Health first ever virtual fall education conference. Our theme this year is Reimagining the Future. We are very happy that you all could join us today, as we know that everyone has been extremely busy working your local COVID-19 response. I want to take a quick minute to thank all of you for your hard work and dedication during this unprecedented pandemic. I would also like to thank Governor Cooper, Secretary Cohen, and our colleagues at the Department of Public Health for their leadership during this challenging time. You all have remained steadfast in your fight, and you should be very proud of North Carolina's response. We have a full agenda for you today, and each of the sections have some really great speakers. I hope that you will bear with us, as there may be some technology difficulties as we go along, and there may be a delay between speakers trying to get them from the backstage to the stage, so please bear with us. I also would like to say a quick thank you to our NCPHA President-elect, Mike Zellick, and his committee, along with Ms. Kim Dittman, our NCPHA Operations Officer, for all of their hard work preparing for this conference. So without further delay, we'll move forward with our agenda. I am going to make a quick change in the agenda and move Secretary Cohen up, as she has another obligation. So it is my pleasure that our North Carolina Secretary for Health and Human Services, Dr. Mandy Cohen, is with us today to share some remarks. Dr. Cohen was appointed to the role of Secretary of the North Carolina Department of Health and Human Services in January of 2017 by Governor Roy Cooper. Secretary Cohen is an internal medicine physician and has experience leading complex health organizations. Before coming to the North Carolina Department of Health and Human Services, she was the Chief Operating Officer and Chief of Staff at the Centers for Medicare and Medicaid Services. She brings a deep understanding of healthcare to the state and has been responsible for implementing policies for Medicare, Medicaid, the Children's Health Insurance Program, and the federal health insurance marketplace. Secretary Cohen has been recognized as a national leader for her work at the Department of Health and Human Services. In February of 2019, Modern Healthcare named Secretary Cohen one of the top 25 women leaders in healthcare. Secretary Cohen is also an adjunct professor in health policy and management at the University of North Carolina at Chapel Hill Gillings School of Global Public Health. She is a graduate of Cornell University. She received her medical degree from Yale School of Medicine and a master's in public health from the Harvard School of Public Health. She's trained in internal medicine at Massachusetts General Hospital, and Secretary Cohen is married to Sam Cohen, a health regulatory attorney, and they have 2 daughters, ages 6 and 8. Please join me in a virtual welcome for Dr. Mandy Cohen.
Hello, everyone, and thank you, Teresa, for that kind introduction. Next time we're going to shorten it, but thank you so much. And it's so wonderful to be with all of you today. I know it's virtually. I was thinking this morning about how can I appropriately thank each and every one of you for what the work you have put into this year. There are not enough words of gratitude and appreciation. This has been a hard year. Yes, we're in the middle of a global pandemic that we have never experienced before. So yes, it's meant to be hard. I get that, but wow, I'm running out of words that can express the unprecedented, challenging nature of what we are going through right now. It is a challenge that public health, I'm sure, will learn a lot from, and I think will make us stronger ultimately going forward. But I know you all have been the tip of the spear for this pandemic. in addition to the fact that you're going through what all of us are going through with COVID and our lives turning upside down and new ways of moving through the world, new ways of our kids getting education, new ways of going to the grocery store, everything being off balance for us. And then you go to work every day and give it your all and serve the people of North Carolina well in this year. I am so thankful, but also so incredibly proud of our work, and you should be as well. And I think it shows in the numbers. Now, they're never perfect. We're in a crisis. Like, perfection is not a thing we aim for, but I think that the fact that we avoided that major surge that happened right at the beginning with the Northeast when they were on fire, and we were working hard to build our infrastructure, to really build out testing, build out our contact tracing abilities, build out our data capture, build out all of our processes. We used that time well. And then when the rest of the South was on fire, we were holding our own. Now, every loss of life and every case is one we wish we could have prevented and get back. But the fact that we have not had a surge of cases like we have seen in nearly every other part of the country really speaks to the hard work that everyone has done at every turn here. And it is hard, right? We have learned a lot, and we'll continue to invest that in the work going forward in data systems and processes and how we work closely together. So just thank you for all that you are doing in both in your professional sphere and also in your personal sphere as well. I know that has been a hard year, but know that I am so proud. The numbers show it. That your work is incredibly meaningful. And I hope that when we look back on this time, I hope that you will look back at this year. Yes, the hardness will be there and the challenges you'll remember. But I hope you also remember it as one of the most important moments in your career, that you were part of this huge team that has protected North Carolina. So I hope you will, one of the values we have at our department is about joy. And joy isn't just celebrating birthdays and milestones. Sometimes it's finding that joy in the mission that we're committing ourselves to together. And sometimes in the day-to-day, hour-to-hour of it can feel really, really challenging. But I hope that we all will look back on this as saying, I was part of this. I was part of this solution. I was part of the protection of North Carolina, and I contributed to that. And so I think you should all feel incredibly proud of that. And we're obviously not done. We have a lot of work left to do. And so we also need to find ways to make sure that we are maturing our processes. Sometime in a crisis, we put together processes just to get by and get to the next day. I think what we're trying to do is systematically improve those processes so that we can start to make this work part of what we do every day, but also to help us sustain this, because we know we're not just going to be spreading the virus. We know that we have flu season coming up, for example, and we know that we have to be getting everyone a flu shot. And frankly, North Carolina is already ahead of last year, so that's fantastic.
Okay.
So we have a lot of work to do with flu season coming.
What happened? I know I had.
Hello? Oh, okay. Sorry, I think I heard Kim there. Hi, Kim. And so I think with flu season coming up, and then we're also getting ready for the COVID vaccine effort. And I know you're all going to be involved in that. So a lot of really important work. And then there are so many messages that we're trying to communicate. Do the 3 W's, download Slow COVID NC, whatever your reason, get behind the masks, put your number into Slow COVID NC, know that there's wraparound supports for you in counties. Oh, there's all these different tests. It's a lot for folks. So just keep up the communication with stakeholders, because all of us who follow this every day, it's hard for us to keep all of the pieces together. So I just would encourage you to make sure you get the latest information from our department, and make sure you're connecting the dots for the folks in our communities. There's so much that we're trying to get done all at the same time. It can be overwhelming, and folks may not know what door to walk through to get the help that they need. So I'm just appreciative of us thinking about all of the work around testing and tracing and this isolation support and how all of it really feeds together. I talk with our team often about how we are very much using the data that is collected across the state to inform every day-to-day decision making. So every piece of data which might feel so cumbersome, and you're collecting it and you're doing the case tracing, case investigation, the contact tracing, all of that feeds back to all the decisions that cascade down. So it's all one tight-knit circle of effort here. So I'm just so appreciative. The other thing that I just want to make sure that we're all doing for all of you that control budgets, make sure that we are spending, because there's federal dollars that disappear at the end of December, and we want those dollars to stay here in North Carolina. We don't want them to go back to Washington, D.C. So make sure we're keeping our eye on spend. So I'm really appreciative of you to make sure that we are helping communities, we're getting that spend done. I know everyone in my department's monitoring this to make sure, again, that those dollars are meant to help you and the communities you serve. So make sure we're doing that. I want to also thank, I know Katie Griffin is the new executive director of the association. Appreciative of having the opportunity to join you. I know everyone's been doing great work, and I know you're going to have a great conference. I just want to leave you with I've said thank you 100 times. I wish I could say it 100 times more. Thank you, thank you, thank you for all you're doing. Keep it up, right? I know it feels hard. Just know that we are in this together. We are going to get through this. I promise it will end. I can't promise when, but I promise this will end. And I know that if we pull together and we continue to work closely together as a team, that we are going to be strong together and ultimately defeat COVID. And so thanks for all you do. I'm going to turn it back over to Kim and Teresa and to Katie and back to all of you to enjoy the rest of the day's conference. Thank you, thank you, thank you for all you do.
Thank you, Secretary Cohen, for being with us today, and thank you so much for your leadership. It is now my pleasure to introduce to you our new Executive Director for the North Carolina Association of Local Health Directors, the North Carolina Alliance for Public Health Agencies, and the North Carolina Public Health Association. Ms. Katie Griffin is an attorney with a special interest in health law and policy. She is a native of Lumberton, North Carolina. She received her bachelor's degree from the University of Miami and earned her law degree at Wake Forest University School of Law. And she began her career with a large firm here in Raleigh, focusing her practice on transactional, regulatory, and governmental relations work. Most recently, Ms. Griffin has been managing her husband's statewide judicial election campaign while he's was deployed with the North Carolina Army National Guard. So after a long and very careful search, we are very thrilled to welcome Ms. Katie Griffin.
Thank you, Teresa, and good morning, everyone. I'm so excited to be here. I want to thank, first of all, Kim Dittman for all of her work to get this virtual conference up and running. It is a new challenge for all of us in 2020 to make it work, and Kim has done a great job. So I want to say a big thanks to her. Also, of course, thanks Dr. Cohen, if you're still with us. We were so glad to hear from you, and I certainly want to echo Dr. Cohen's words of thanks and appreciation for all of you who are working on the front lines battling this pandemic. I am in awe of you and look forward to learning more about you and your stories. I won't speak long because it's a long day and we've got a lot of exciting things ahead of us, but I do want to say, I'm from Robeson County. I've lived in Forsyth County, and I'm also, a Wake County resident for the last 4 years, where I live with my husband, Jefferson. I have a Labradoodle named Beasley. I'm passionate about health law and policy and making North Carolina healthcare as good as we can make it together. So I'm thrilled to be here. I hope you'll reach out to me and the coming days and weeks and months ahead. I know you all have a lot of work going on, but when you have time, I'd love to get to know you. So my door is always open. My phone is always on, and please don't hesitate to reach out if there's ever anything I can do to help you. Thanks, and looking forward to a great conference. Teresa, I think you're still muted if you're.
Sorry, everybody. At this time, I would like to introduce you to the 2020-2021 Executive Committee for the North Carolina Public Health Association. This will be a recommendation for committee that will need no second. And once I have introduced the slate, if you would please look to your right, there is a little icon up there that says polls. If you will click on that, that will give you the opportunity to vote yay or nay. So we will begin with me, Teresa Ellen, as your past president. Mike Zellett will be your incoming president. Leah Mayo will be your president-elect, and Rod Jenkins will be the vice president. Ms. Kim McNeil will be our secretary-treasurer. David Howard, our membership committee chair. Peg O'Connell, our advocacy committee chair, and Chris Hoke, our ad hoc counselor of law. Now I'll introduce our members at large. Joy Brock will be from Region 6. Anita Ramachandran from Region 2. Bruce Robusto from Region 4. Honey Estrada from Region 3. Nina Beach from Region 5. And we will need to fill our Region 1 spot very soon. So if you would please, again, as I said before, go over to the poll and vote yay or nay for us. Okay, by a majority of the vote, our NCPHA Executive Committee has been approved. Next on our agenda, I would like to introduce our speaker today, Ms. Tanya Bass. Ms. Bass's topic today will be the history of systemic racism, what it means for public health. Ms. Bass is the Cultural and Community Health Initiatives Program Supervisor for the North Carolina Office of Minority Health and Health Disparities. Tanya has several years of public health experience in the areas of health equity and reproductive sexual health. She is a skilled trainer and facilitator. She's an alumna of the North Carolina Central University Department of Public Health Education, where she has served as an adjunct instructor for the past 15 years. Tanya is completing her doctoral requirements in education with a focus on human sexuality studies at Widener University. And please join me in welcoming Ms. Tanya Bass.
Good morning. Good morning. Thank you so much, Teresa. Thank you all for the association for having me today. I'm really impressed and excited about this technology. So hopefully I'm going to get us started here. Let me go back. I have to remember to follow the instructions of the people who are supporting us. And so if you could just bear with me as I try to share my screen with you all. Let's see. Well, hold on. Maybe I can put it up here. Yeah, we're going to try this. I'm not sure if someone could tell me in the chat what you see. That would be great. Let's see. All right, so I hear people saying it's showing. So do you still see the slides? Hopefully you do. All right, so I got a yes. Now I have to figure this out. All right, this is my last time checking in. Hopefully you see the slides and I won't worry about seeing me. How about that? All right. So Kim, I'm moving forward. I text you this morning. If you can't see the slides, you let me know, and also let me know if you only see the slides and not the notes. So I'm going to jump right on in. So again, excited to be with you today, and excited in a way of like I'm really privileged and blessed to be working and to be working in public health, even to a critical time as such as this. But also a little bit of like disappointment in that as I came into this work, I started my career over 20 years ago as a public health education or educator. And I was always taught and trained that I would work myself out of a job. And I don't know many of you who may have been in how long you've been in the profession, but you may know Dr. Ted Parrish. And Dr. Parrish was one of my instructors at North Carolina Central University. And he was just a great mentor for me. And I remember doing community work and having conversations, the same conversations, unfortunately, that we're having today. And so I come to you for the North Carolina Office of Minority Health. And even when I think about when I was working here the first time in the late 90s, I was so excited and energized to be working and to be working for this office. And then coming back in 2017, a level of excitement, but still disappointment that I'm still addressing in this office. And all of us as public health professionals are still addressing some of these same issues. And when I look at our vision, we have always had health equity as a part of our work, that all North Carolinians would be able to enjoy good health regardless of who they were. And while we know that we are looking at revising our vision and revising our mission, ultimately our goal is to ensure that everyone in North Carolina experiences good health. And so our director currently is Cornell Wright. And for those of you who are unfamiliar with the office, it was created in 1992 along with a Minority Health Advisory Council. And throughout the years, the council and the office have worked to create legislation, support policies, and programs to really address racial and ethnic minorities. One of the first cultural competency curricula that was statewide was created in this office. There were several trainings, including the Nosotros training to work with Hispanic, Latinx communities around public health. There was an African American training and portion. There was interpreter training services. So we've had our roots and our work grounded in addressing the health of racial and ethnic minorities in all marginalized populations, but specifically looking at how race and racism in particular play a part in health. So here's what I need you to do. I was planning this talk and of course hoping that we wouldn't have to be isolated in our homes or in our offices, but nevertheless, as a good health educator, you can always try to adapt your learning and your style. So what I'd like to do is to offer up an abbreviated session that we do in our office in some of our workshops. Many of you, if you've participated in some of our trainings, you may have participated in a similar activity. And each time I have to let you know that it's done different. So I hope you approach it with new eyes. And so what I'm going to ask you to do for the next few minutes is actually pay attention to the slides. I'm going to ask you to be fully present and don't use this time to multitask. And I know that that is hard because we have so many things going on, but I'm asking you, imploring you to commit to giving your undivided attention for the next few minutes as we go through this. And then I want you to look at these slides and gather what you can from these slides. think about what sticks out for you. Jot down some things you might want to grab, scrap sheet of paper or something. What is new to you, like new information, what you see on the screen and how it might impact you or someone you know or love. And most importantly, what you see on the slides, how they might influence your work or how you do it. So this is a timed activity, and I'm going to go ahead and start. And again, I'm going to reach out to Kim, and I know I have a secret shopper out here texting me. So please let me know if all is well. And I'm going to go ahead and start. And so your undivided attention is needed for the next few minutes. Be sure to take note. All right, we're going to start. Excuse me. So again, I'm just going to remind you, and maybe some folks are just joining, that you're going to just jot down some things as we go through this timeline activity. We have a few more slides to go. Of course, you can see we're in 1933 right now. Think about how it impacts your work, maybe you personally or someone you love or know. Stick with me as we continue on, jotting down things that stand out for you, taking note even of your feelings about what you're seeing. Just a few more to go. It's a small thought error on here, but hopefully you can read the American Recovery and Reinvestment Act, what most of us or many of us may even call the stimulus. All right, we're winding down. All right, so thank you for your time. And I would just ask as we wrap this up, is that you observe yourself in your body and just reflect. Like, what are you feeling in your body? Where are you feeling it? What are the emotions in terms of feelings? Like, what are your thoughts about health, public health, your work, the system, racism in this very moment, based on what you already know to be true, what you have just viewed in the state of the world right now. And I ask you to jot down and take note of your feelings and maybe use single words to describe your feelings. And you can place some of those words in the chat. And just be mindful to continue to reflect and own those feelings. So I'm going to ask for a few people, if you would, put it in the chat. And whomever is moderating, I don't know, Teresa, if you're able to come off mute, and if you see anything in the chat before we move on, any feelings that we can acknowledge. Do you see any feelings in the chat that you're able to share with us?
I've not seen any so far.
Okay.
This is Kim, and I've seen triggering, ashamed, very sad, angry, disgusted, anger, frustration, ashamed of our country, angry again, bias, hurt,
Thank you, Kim.
sad, it is real, disheartening, angry and sad.
Okay. Thank you so much, Kim, and thank you all for like reflecting and thinking about your feelings. And these feelings are valid. Like, we come to work every day. Like, you brought yourself here this morning to participate in this conference and continue to celebrate one another, support one another. But the reality is, these things have happened. This is history. This is facts. No one made this up. But also the reality is that we might feel, as my students would say, some kind of way, meaning that there's an emotion there. Sometimes we don't get to tap into it and why we might feel this way. But I also encourage us to use those emotions as motivators to continue to do good work. It's sometimes discouraging. What I know for sure is Indigenous lives matter, Black lives matter, Hispanic Latinx lives matter, queer, transgender, non-conforming, young, old, able-bodied, limited body, fat bodies, all people do matter, but we have to look at the root of what's going on. And some days I really feel like we are failing the community. And by we, I mean me too. Sometimes I don't think I'm doing enough. And sometimes I wonder if the system even allows me to do what I need to do. We're failing the community when we don't take time to really consider how racism plays a part in the very thread of what we do. Now, while I look at that timeline, there are some things up there that make me cringe and some things that remind me of the hope of what we can and need to accomplish in order to address health inequities, but more importantly, get to a place of racial justice and racial equity. Timely enough, during this week, I had two people on my mind. The first person, not pictured here, is my grandmother. 2 years ago, on October 2nd, my grandmother passed away at 98 years old. And I was fortunate enough to move to North Carolina with her, not because my mother couldn't take care of me, but because I loved being outside. And we lived in Beaufort County, outside of Little Washington. And I thought I wanted to live with her and live in North Carolina. And I think about how she raised me and the way she carried herself, which brings me to the person who is on your screen. When I look at pictures of Fannie Lou Hamer and what she stood for and who she was and is in our lives, it reminds me of my grandmother. Unfortunately, when I think about Fannie Lou Hamer, as all the good work that she did, I'm still reminded of the injustices that she faced, the violence, the fear that she had to live in. And most importantly, I think about the fact that she went in to get a procedure to take care of her health. And because of racist and misogynistic laws and a system of eugenics, she actually had a hysterectomy performed on her without her consent. But what I know about Fannie Lou is that I'm also sick and tired of being sick and tired. As I get closer in age to my grandmother and to Fannie Hammer at the time of her death, I just think about, when will all of this end, or what can I do to help be part of the solution and not the problem? And as you think about the timeline, some of you are probably like, well, what's the point about talking about the past? The past is the past. We can't go back and fix it. And that's true. And I often hear people say, oh, well, history might repeat itself. Fact is, history can't repeat itself. So today is October 7th. 2020, it will never be this day again. But what we need to be mindful of is that the mistakes and the lessons, and in particular, the lessons that we need to learn, so we're careful not to repeat the mistakes of the past. Each present moment brings us a unique opportunity to do something different in a different way. So that's why it's important to look back on the history, not only the history of the United States, but be mindful of the history of North Carolina. We are not immune to the racial, economic, and social oppression that has happened nationally, because it's happened right here, right related to health and human services in our state. And so we have to think about addressing it from the perspective of knowing what the history is so that we don't make those mistakes again. Historical trauma is something that goes throughout generations. So if I may bring up my grandmother, again, thinking about all that she saw, having been born in 1920, and all the lessons and how she was able to teach them, but also how some of the trauma transferred from her to my mother and from my mother to me. And let's just be clear, all of us are inheriting a level of trauma. And some of that trauma is respective of the violence that our ancestors inflicted on others, that maybe some of our other ancestors saw, or were experienced the violence at the hands of people who look just like them. So none of us escape it. We're literally a bunch of trauma-filled bodies in different ways, interacting and trying to help other trauma-filled bodies. And throughout the generations, if we don't know what that trauma is, and if we don't know how to address it, we can't. Now, public health has that history that I was talking about in the timeline, both travesties and breakthroughs. But one of the things I know for sure is we know how to engage communities. The only thing that we need to do better is, well, not the only thing, but one of the things that we need to do better is to address and create strategies from an anti-racist perspective. Because if we keep building programs and systems and policies and we're not using an anti-racist lens, all it continues to do is cycle out and continues to perpetuate racist ideologies, practices, and service delivery. So let's talk about it. Race is not racism. Racism is a public health issue and a public health crisis. Race itself is a social construct. Racism, a root cause, and is a root cause to health inequity, and it must be addressed, and it must be put to an end. Now, if you don't know what anti-racism looks like or what it is an active process of identifying and eliminating racism by changing systems, structures, policies, even your own thinking as individuals, and how that shows up in your work. What we know from Dr. Kamara Jones is that racism is a system. And it's the way that we place opportunity and sign value based on a social interpretation of just how people look, and creating fair and unfair advantages for people solely based on how they look or the representation of their skin or these race classifications. What we also know is that racism impacts nearly every aspect of a system that we have to engage in just to live in this world. When we look at segregation by race, poverty, education, and other social factors, it accounts for more than a third of the total deaths in the United States every year. Racism creates huge economic burdens on the United States. When we think about from 2003 to 2006 alone, $1 trillion. And so if we know that racism impacts all these systems, then we can also know, and I would dare trust, like right now, I feel like I'm talking not to myself, but I know that many of you have heard this before and you've seen this before. What I hope you do is leave here today with a renewed energy to really understand it and apply it. So when we think about the social determinants of health, or the drivers and determinants for health or health equity, racism impacts every system up here. So you talked about, and many of you have even gone to, I applaud you for going to trainings such as the Racial Equity Institute or other trainings, maybe reproductive justice workshops with Sister Song. And that's great. But going to a training and doing nothing about it or not informing your other colleagues or the way you do your work just means you went to a training, you got some CEs, maybe you networked with a few other people, but it didn't inform your work. When I came back to the office, I had a different worldview, an expanded worldview of how I would approach this work. So I'm hoping that when you think about racism, how it impacts education, health and healthcare, neighborhoods and the environment, economic stability, social and community context, and trust and believe, trust is a social determinant of health. If community members, we see that now more than ever with COVID-19. If folks don't trust us, and we have, as people, period, we have a lot of reasons not to trust the government, systems, or people in places in authority. But we have to do what we can to make sure that we are the best representation of these systems and that we dismantle racism in all that we do in our work. So what I like to offer up is we also need to value lived experience as evidence. So allow me again to tap back into memories with my grandmother. So in full disclosure, and y'all can counsel me later, I tend to sometimes speed in the state of North Carolina, getting from one place to another. And sometimes without even noticing that I'm speeding. A few years ago, with my grandmother, I was doing some caregiving for her, and I got pulled over by a state trooper. And so we were talking about how trauma crosses generations and how it shows up. When I got pulled over, yes, I was speeding, so there that is. But I noticed that my grandmother kind of did a low hum. She rocked a little bit and started like tapping, not necessarily clapping her hands. And I'm thinking, I'm getting stopped by the police, and now she's literally breaking into song. But what I didn't realize then that I realize now is that because of the trauma and issues that my grandmother had faced around policing of her body or brutality, having been born in 1920, she's seen a lot. She was actually soothing herself, calming herself in a very stressful, intense situation. And although I didn't recognize my own adrenaline flow and stress response, I recognized what she was doing, and it was distracting me and almost aggravating me because of this high stress moment. And so once we started talking about why she was doing it later, it made more sense to me. Now, the unfortunate thing is I shouldn't feel the same response of stress that my grandmother's feeling in these times. Things should have changed. Systems should have changed. And so we have to be careful not to forget that lived experience of others from previous generations are important experiences to help us do better in public health as we move forward. Now more than ever with COVID-19, we have to address that. So when I think about her experiences and the experience of traumatized bodies, I'm actually reading a book called My Grandmother's Hands. And it talks about recovering and understanding trauma and how it feels in your body. And one of the quotes in the book speaks to why we need to address racism and what the implications may look like in public health. So we've over time heard or have defined health as not just being the absence of disease, but here it's offered. Real health is the will to overcome every form of adversity and use even the worst of circumstances as a springboard for new growth and development. And simply put, the essence of health is the constant renewal and rejuvenation of life. No one can speak to that more than marginalized communities, of how you tend to turn adversity into that springboard for something new. But we need to stop creating the adversity. Like, some things are out of our control, but other things, as public health leaders, we can control it. Another quote is, the past and the present racial patterning of disease reflects institutionalized racism. And when we go back to thinking about that slide with the social determinants of health or the key determinants of health, We know that public health can't do it alone. I thought about that working myself out of a job. My goodness, that was 25 years ago almost. I'm still here. We're all still here. So we know that there are things we're doing right, but there's so much more that we have to change in order to have an impact. Now, some of you might say, well, I treat everyone the same. I've been doing public health for years. I've never had any problems or complaints. And I would just ask you to, again, assess yourself and assess your work. More so, assess your community. Because there are racist ideas that impact public health that have been around since forever, if that's possible to say. And a lot of times our work shows that. So there's several racist ideas, but the two that I want to put before you today are the most familiar in my mind. And these ideas offer these explanations of like health disparities, in particular Black and white, or health disparities for anyone who's non-white. And the first argument is like the genetics argument that, non-white bodies are just inferior. That's why, there's so many disease conditions that they're dealing with. And it's almost like, I remember hearing students at North Carolina Central University in their public health courses feeling like, man, we die from everything. We get everything. And that's just a racist idea. The second is the one we're going to talk about, and it's usually the more dominant because that one still is out there in wholes. But I think this one is the one that we operate in, and it holds that health issues are solely based on the poor choices, actually placing blame only on the individuals and not the systems that individuals have to navigate. So I'm sure you've heard this. It kind of sounds like this. Well, I don't understand why people are sick. I know life is tough. But I mean, you don't have to overeat. You don't have to not exercise. You don't have to go out and march. You don't have to engage in violence. And you don't have to ignore, or you shouldn't be ignoring, medical advice. Now, I won't ask you to put it in the chat, but I'm sure that you either thought this or heard this from colleagues. And that's the problem. When we look at how we're treating people and thinking about these racist ideas from the standpoint that the systems don't actually play a role in how people have to navigate the systems. So the implicit bias that comes with calling someone non-compliant doesn't take into the account the racist systems that will keep someone from having adequate housing to store medication that needs to be refrigerated. So instead, the person doesn't take it. And so calling someone non-compliant ignores all the other issues that individuals can actually be facing rooted in racist systems that may impact transportation, that may impact access to care overall, and that may impact even housing or education. So we can't just place the blame on people without solely breaking down the systems that created these problems in the first place. There's so much we can do that allows us to go and assess our programs and think about what we can do differently. So let's talk about it a little bit and how it even shows up statistically. Because I think we all know about health disparities. Most of us have seen it in our work. We've had conversations in the community with our staff and with other partners in the public health arena. But what we know is in 2017, Black mothers were 2.3 times more likely than non-Hispanic white mothers to receive or no prenatal care. So accessing, when we think about infant mortality and maternal mortality, there are some reasons that these things are occurring. If you remember on the history line, there was even a slide about Serena Williams, the Serena Williams. I bring that up because even the Serena Williams had to advocate to get a service because she was more in tune with her body. Remember, lived experience is evidence to say that she was experiencing pain and that she needed to get a CT scan. And she had to demand the CT scan. And they actually didn't do the CT scan first. They did an ultrasound and found nothing. So what if they hadn't listened to her and not done that CT scan when we know that there were clots being formed? That could have ended her life. Then we look at the next one. Black children are or 4 times more likely, sorry about that, to be admitted to the hospital for asthma. So when we think about, are these children being admitted for what reasons? What are the other reasons or implications financially on someone being admitted? Was it a misdiagnosis? Was the child even screened? So all of these things play a part in understanding how racism shows up in public health. And then finally, I know we had Secretary Cohen on, and I'm proud to be working in this office on some of the response to the COVID crisis. But I also know I still have that looming feeling of we're failing the community. So we know COVID doesn't discriminate, that anybody can get COVID-19. And it is not lost on me that many of you have your own ideas around how racism either exists or doesn't exist anymore. It's not lost on me that we've had conversations in communities in this office and trainings where people have looked at some of the facts on the timeline and argued that because they didn't know about it, it probably didn't happen. It's not lost on me either that if it's not impacting people who look like me, then I'm not going to be of so much concern. And so when we bring it to full circle to 2020, one thing is clear: COVID-19 can impact anybody. But we see that this crisis is still having a greater impact on historically marginalized populations. And so I am proud that I think collectively through local health departments on the state level, from the state department division of public health and from the Department of Health and Human Services, we are doing our best, but we're still learning lessons. And I'm appreciative of the anti-racist lens that we're attempting to use to address this. And are we getting everything right? Probably not. So if you're familiar with the 3 W's, they came out first. And I want to give a shout out to anybody who knows Norma Marty, a dear colleague who came out of retirement to help us address COVID-19 in all of our communities. And one of the things that people, sometimes when we're like, we need to respond, although our response can be great, but the South in and of itself, so not just North Carolina, but many Southern states, fail to address language issues and information provision for people who may be Spanish language speakers. And so when things were developed, they weren't developed collectively. We have to stop making marginalized populations second thoughts. If we're going to do something, we're going to go ahead and do it collectively. If it needs to be done to impact the whole, to make it specific that the whole gets everything at the same time, so that the messages are consistent. So Norma Marty helped us and offered up what might be better than just a translation, but to make sure that the translation was meaningful and that, we make every effort in public health to address things head on with an anti-racist lens, with an inclusive lens, so that we don't leave out people. And the reason they're called marginalized populations is because they're left off to the margins. And then sometimes we try to scoop it in and recover. We got to stop recovering. We have to be proactive and think about how we make sure we address the whole of our communities. So then it brings me to another valued experience, or the importance of valuing lived experience. People are struggling and hurting pre-COVID and during COVID. People are still being racialized and racially discriminated against, and people are still being left out on the margins. And how does that impact public health? Well, I recently saw that even people in fear are more concerned with COVID-19 and being safe, and also being safe from not being policed, that breast exams are actually on the decline, and that, like the mammograms. And so we want people to still take care of themselves. But if we're in a state of civil unrest and we're in a crisis with a pandemic, it's kind of hard to prioritize that. And if you don't feel safe or think you're going to be picked out or, of any violence projected against you, it's kind of hard to navigate that. And it's important to prioritize our safety. That's what we're prone to do. So I think about this quote. I don't want to have to worry about where I live, how I look, or what people might fear about me. I literally want to be able to go to the grocery store, get what I need, come back to my apartment and cook. And when you're living in fear that you can't even leave your apartment, go get groceries and come back, that's how racism impacts public health. And what I know also to be true is in order to advance health equity, we have to address racism as a whole. We've struggled for years trying to address health disparities. And now we see more and more that the state health department and local health departments are being more vigilant and using anti-racist health equity strategies to create a way to uplift the imbalances in power, to create practices and policies that will foster equity for everyone. That staff are not only going to get training for a better understanding, but they're also using a level of attunement so that they understand the positionality of the communities that they serve. This is the only way we're going to advance health equity, is to call and name out racism as a root cause and address it as such. When we think about equity overall, remember, public health and healthcare can't just be siloed. It's about the working together as a collective to address, support, and sustain social justice. Really thinking about shifting power and allowing people to have access to resources, information, so that they can make the best decisions for themselves. One of my favorite quotes about health equity is from Dr. Paula Braveman. And what Dr. Braveman offers up is health equity means social justice in health. That's when no one is denied the possibility to be healthy for belonging to a group that has been historically, economically, and socially disadvantaged. We have to remember the people on the margins moving forward. Another quote is, to improve health outcomes, racism must be addressed not only by those who work directly pertaining to racialized health disparities, but also, or those who are historically marginalized groups, but by all people working in public health. So I work in the Office of Minority Health and Health Disparities. For years, people would say health equity is our thing. No, y'all, it's our thing. We're all in this together. There are some specialized projects, some programs that our office works on, but we're supposed to be addressing racism and health equity across the state, whether you're a local health department, community-based organization. It shouldn't fall on one office. An office should be able to help, but all of us play a vital role. And that role also means to do some introspection, some new strategies for even yourself and how you navigate your personal space. So what I'd like to offer up, we know racism is a root cause in health equities and health disparities. Addressing racism is definitely critical to addressing health disparities. So what I like to offer is that you consider a health equity framework that centers racial equity and social justice. I'm fortunate to work with staff at the Division of Public Health who have created a draft, a pretty decent health equity framework for the state of North Carolina. And what it requires is for folks to really use an anti-racist lens to think about the work that you're doing. That includes your hiring. That includes your program and service delivery. That includes looking at who's being left out and on the margins. And one of my favorite words is thinking about unintended consequences, because sometimes we have the best intention, but our impact can be something negative on a lot of people. In our office, in the work that I do, addressing and adapting the class standards as a way of assessing your agency. Now, I'm pretty sure some folks on the line received some of our class funding when we first started out. We're just now getting mobilized. Of course, we're trying to do it in the middle of COVID, but the class standards are a great way to think about how your services are being provided, how your agencies are operating. And it takes everyone, whether you're the local health director or the administrative clerk at the front desk. Everyone in your agency has to understand what health equity is, utilizing an anti-racist lens, and being able to provide a service to the community. And then center the community in the shift of power dynamics. One lesson that we're definitely learning through COVID-19 is that those closest to the problem are actually closest to the solution. And I know some of us are working in counties. I think I just heard Katie talking about being a North Carolina native. And granted, we know if we've lived or been in one county, we've lived and been in one county. What we have to know is that sometimes based on our position alone in the health department or other agency makes us one level removed from the community. And so we have to engage the community to make sure that their voices are heard, inclusive of yours because you're part of the community, but mindful that those closest to the problem are closest to the solution and giving them voice. So here are the 3 things that I say as a call to action to you as I bring this to a close. Now, because I love training and I think that it's important to have those lessons and that information to keep us going, it was a struggle for me not to put that as number 1. And the original order was training, research, community engagement. But what I understand is addressing the community is most important. So I flipped the order to say community engagement and advocacy. Remember, those closest to the problem are closest to the solution. The community needs information, just like right now. People want to know what's going on with COVID-19 and other health issues. Let's think about it as making it a practice that instead of all the scientific meetings or the academic meetings, let's start making sure that communities know what's going on in communities with the research that's going on, with data that you're collecting, if you're doing your community health assessment. And although I know we have gaps in the technology access and even broadband service delivery, let's use this time where people are utilizing online technology more to provide them with information and get feedback about what's going on in the community. That's number 1. Number 2 would be training. So having talks like this, the things around different conferences and workshops that you'll be participating in today and tomorrow is super important as part of your own professional development and growth, and connecting with others as part of your training, so that we can understand the history and the past so that our future will be brighter and that we can dismantle racism and do some internal work. Think about even how you show up for others, whether it's your colleagues or the community members that you serve. And then finally, not saying that research is not important, but research must implicitly name racism and examine implicit and explicit bias so that we are careful not to make those mistakes and continue to enforce racist ideologies. So I thank you for your time here today. I would love to hear some dialogue and question and answer. I encourage you to do this if you do nothing else as we continue on this journey in new ways and gaining new insights. Is that think about the only way to really address racism in public health is sometimes you have to speak up, sometimes you have to shut up. You're probably going to mess up, but do your best to correct it. But the biggest thing is please don't give up, because the work that you do is important and we all need each other to make a difference. Thank you.
Thank you, Tanya, for being with us today and for sharing those very important words for careful thought. I'd like to echo what Dr. Cheryl Kovar shared with us in the chat, and that is to say we all need to work and think together. So this is going to conclude our plenary session. However, our GlaxoSmithKline Awards have been pre-recorded. Please join us at noon for that presentation. And also, please check your schedule for your section presentations and log in at those appropriate times. Again, I thank you for being with us this morning, and I hope you have gained some thoughtful insight.
Hello, this is Kim. I just want to also mention that Leading in Uncertain Times, which is a public health leadership session, that will actually be shown today at 1:30 rather than at 1:30 tomorrow. And it is a pre-recorded session, so you can just go to the Sessions tab on the conference platform, and you'll find it there available at 1:30. Okay, thank you.